Okay, there are the most common x-rays we take are bite wings, periapicals, and panorex. Um, let's see, I'm sure everyone's always seen this before. Panorex, you know, the one big film with all the teeth on it. When you look at a panorex, you're not necessarily looking at the teeth. You definitely don't diagnose cavities off of it, but you're looking for any pathology. You're looking for cysts, discrepancies in the bone. You can look at the teeth a little bit to see if like they have wisdom teeth that are impacted, but it's amazing how many pathologies that you can tell just by taking a regular pan. So in my office, every patient gets a pano every 5 years, whether they're symptomatic or not. And you would be surprised how many extra teeth I have found and how many patients I have sent to the oral surgeon because, oh, they have 3 extra teeth that no one knew about until we took this x-ray. So it's a very useful tool. This is called full mouth series. It's a lot of individual x-rays, but it's a good combination of periapical, which just show you the entire tooth on there, and then the bite wings, which show you in between the teeth. So the bite wings are mainly for diagnosing cavities in between the teeth that you can't see clinically, because you might look at a tooth clinically and say, oh my gosh, it looks great. But when you take the bite wings, you realize there are lots of weakening in the enamel, or they might have a cavity that you can't even begin to see clinically. So it's a good tool for catching cavities small before they're huge, before the patient needs root canals or extractions. And then I found this online. I thought it was really, we can all tell there's something wrong with that molar there. So that's a periapical. So again, but before you do any kind of extractions or anything, you want a whole view of the tooth, just in case you're walking into something like this. It will completely change the way you treat that tooth, or don't treat that tooth. No one would ever save that tooth because that tooth is gone. But seeing that might say, hey, my patient needs an antibiotic, or if I'm going to extract the tooth, I might want to use these particular instruments instead of this one, because this one will do absolutely no good. So periapical is good for looking at the individual tooth top to bottom. And when you do root canals, you take a lot of periapicals, because again, you're cleaning out the entire tooth. So you want to make sure that you're all the way down to the very bottom of the tooth. Like you don't want to stop up here. You want to go all the way to the bottom of the tooth when you do a root canal. And one of the ways you're going to know that is in x-ray.